This live chat for the Intro to Public Health. I hope you're doing well and progressing through the semester and following along our syllabus. We're almost through the course now. So I thought today what I wanted to do was have a little chat about some content in the chapter 14 of your textbook, which outlines a number of areas related to systems thinking and the One Health concept. And so what we want to talk about today is the One Health concept, particularly also as it relates then to the interaction between human and animal health. And then I will post a pre-recorded lecture regarding the other aspects of this chapter on system thinking. So overall, our objectives for chapter 14 would be to go through these elements of system thinking. I'll do that in a pre-recorded time. But I want to talk today about the One Health concept and an example of how our health is very interconnected. And I think the COVID experience shows that very much in the connections between human and animal health. And we'll talk a little bit about the impact of climate change on health also. So the One Health concept means that, and by all means, please do not hesitate to put things, into the chat box or submit questions that way. One Health concept means that our health is dependent on animal health and also on the health of our broad ecosystem. And it really focuses on understanding the interconnections between the health of humans, health of animals, and our ecosystem. So we can communicate that by this Venn diagram that shows the series of three circles intersecting human health, animal, and ecosystem. And at some points they all intersect, but humans interact with animals, humans interact with the environment, and there are effects on our health of both of those things. Animals, of course, are influenced by the ecosystem, and then that in turn may affect our health, as we'll show you with a couple of examples. So the One Health initiative was really launched by the veterinary medicine community, but it has evolved into a collaborative effort of multiple health science professions working together globally, both locally, nationally, and globally, related to the health for all of these areas: people, domestic animals, wildlife, animals, plants, and our environment. And of course, the impact of climate change on our environment and what that's doing also to health is very important also. So the framework for discussing One Health revolves really around three key components. There are microbiological influences on health and disease. We're right in the middle of seeing that in its most acute and serious form with the COVID-19. There is health of our ecosystem and our physical environment, which influences ultimately our health as well. And there are interactions between human and animals. I'll talk a little bit about that also. So this figure talks about the overarching umbrella concept of the One Health, which includes disciplines of environmental health, ecology, veterinary medicine, broad public health, human medicine, molecular and microbiology, and health economics, and talks about a couple key domains: our individual health as people, population health as different populations, however you define that, community, state, country, continent, planet, global health, and then health of our ecosystem. And we see that there are a number of crucial areas, but particularly there are issues related to the zoonotic infections, which again is what we're living right in the middle of right now. Viral infections. There are also vector-borne infections such as Zika, which is or others transmitted by mosquitoes or parasites, for example, malaria, bacterial infections, evolving resistance to antibiotics and microbial resistance, which is very important. All of these things are part of the concept of One Health and how they are influenced by the interaction of people, animals, and the planet. On the other side, human medicine, translational medicine, cancer and cardiovascular disease in humans is a very relevant area. Joint disease, for example, Lyme disease, which is a tick-borne infection, which then can lead to ongoing polyarthritis in people. The human-animal bond has positive health effects. I'll talk a little bit about that. There are environmental exposures to hazards, and we can go on and on. So you see that how humans, animals, and our planet and ecosystem interact is very much important in overall health of those different stakeholders. So things that are ecosystem factors with major impacts on health: global movement of populations. Here, this was really referring, and this happens in two ways. One is, of course, large migrations of individuals that occur with disaster or war, civil wars, and so on, that we see with refugees and others. And that's a very serious and important impact on global health. But just general travel and air travel, and we've had a firsthand experience over the last 3 months of how small the world is in terms of air travel being able to connect many different cities thousands of miles away with the transmission of serious infection such as COVID. Historically, these kind of infections used to be transmitted by ship, when that was the main way that people would be moving between, say, Europe and North America or elsewhere. But nowadays it's airplane travel. And the global movement and the pathways of these populations and their travel is very important. You may know that it's been documented that much of the COVID infection on the west coast of the United States did originate in China and Asia. So when they type the genomic sequences of the virus recovered from patients, they can trace it back to the origin in China predominantly. But it's been demonstrated that the outbreak in New York and most of the seeding of the virus within New York's population came from Europe, Italy heavily, but some other countries. So the patterns of air traffic and travel and global movement of people really do influence health in different countries. There are changes in agriculture and food distribution that influence the health of populations. Changes in use of land and resources, very important. Floods and tsunamis and hurricanes, earthquakes, natural events that really can change the land resource use, ecological and ecosystem can have a big effect on health. And then ultimately climate change, and we'll spend a bit of time going through how climate change impacts human health. So this is a diagram about climate change, and it shows you a few things here. I just want to make sure that you can hear me better. Is that better, Valana? Let's make sure. Okay, I'll pay attention a little more to that. I apologize if this had a little bit of trouble with this microphone. So let's go back to the screen. Here we see how climate change and different aspects of climate can drive different health outcomes. So, for example, extreme heat. What we're seeing are more frequent, severe, prolonged heat events. There's no question about that compared to years ago. Just in my time in Oklahoma, over 20 plus years, I've observed this quite clearly. And what we note is that whenever we have a serious heat waves or several days or a couple of weeks of very elevated temperatures, there are segments of our population who are at serious risk, especially, for example, the low-income individuals in low-income housing. If they don't have significant air conditioning or adequate control of the temperature in their dwellings, they can be subject to severe health impact of heat, dehydration, heat effects that can lead to poor health, especially if they already have some underlying health conditions, if they're elderly and so on. Now, the outdoor air quality is very important. We talked earlier in the course about some examples of the impact of particle matter, particulate matter on health, on our health, and some studies we've seen that shows that mortality is higher among people with who are inhaling or live in areas with high concentrations of particulate matter in the air that comes from pollution. These things trigger events in the lungs and can also trigger problems in the heart also. We also have issues related to ozone, but particulate matter and pollen counts, of course, for allergies and so forth. Particulate matter particularly is associated with premature death due to cardiovascular and respiratory illnesses. Wildfires are contributing to this significantly as well with respect to the increase in ozone, decreasing precipitation, and so on. Flooding, so the global warming, climate change is leading to rises in sea levels with more frequent and extreme precipitation. And this is leading, of course, to events that are related to that, but there is contaminated water, debris, disruptions, and these have negative impacts on health, of course, gastrointestinal disease particularly, and mental health. One of the most significant areas are vector-borne infections. Vector-borne infections mean things which are transmitted by another organism like a mosquito or a parasite or so forth. Here they're using, as an example, Lyme disease. So changes in extreme temperature and seasonal weather patterns may promote or make a better environment for the growth of these vector populations, either particularly, for example, ticks or mosquitoes. Here, in the case of Lyme disease, ticks show earlier seasonal activity and a northward range expansion, so they can continue to move up into what have historically been cooler climates where they're not as happy to be. And this in turn leads to more transmission and exposure to Lyme disease among people. Under this vector-borne area, of course, again, we can think about Zika, and that's another example of where the vectors, the mosquitoes that transmit the Zika virus, have been flourishing in various parts of the US and can support the introduction of that infection into our population once a person is infected. So if people travel from endemic countries, they get bit by mosquitoes here, then that infection can become endemic in our society. And that is the case for Zika virus, for sure. If we go to then, excuse me, water-related infections, again, there are various organisms, Vibrio, which is contained in certain waters and certain countries, again, with changes in the temperature can foster these organisms, or again, if there's increased precipitation and runoff, then there can be an increase in transmission of these organisms as well. Food-related infection, the driving event will be, again, increasing temperature, humidity, the length of the season. Salmonella is a good example here. Salmonella is common among a number of things that we eat, particularly poultry and other things, and this can be increased in our food, and seasonal shifts in the temperature and humidity may make conditions more ripe for these organisms to survive. And of course, climate change affects mental health and well-being. Certainly, I even notice that it's always a much needed break to have a nice sunny day. And if we have extreme weather, this can lead to grief and behavioral health changes. So this, I think, is a table worth studying a little bit, just to remind yourself of the broad way in which different climate changes lead to different exposures that can change our health significantly. Well, there are positive effects of our interaction with animals. This is often known as the human-animal bond. And it's well documented that, for example, domestic pets, bonding between humans and domestic pets can have health benefits: reduced blood pressure, reduced cholesterol, reduced feelings of loneliness. They're using this very significantly, for example, in providing pets and time to be with pets for elderly individuals who, have, a shortage of family or contacts or friends or individuals. And so there are many positive things that have been documented based on our bond with domestic animals. I'm a dog lover in a big way. I have 2 dogs, and their interaction brings a lot of joy and can be relaxing, and you know, you can see these changes here, which are important health benefits. Our interaction with animals, particularly domestic animals, dogs and cats, also puts us at risk of some other health conditions. Rabies, 99% of all cases of rabies in the world are transmitted by dogs. And this is very important. But we can control that by vaccinating our dogs and by preventing them from getting interactions with other animals that are the vectors for rabies. Rodents, for example, rats, of course, but squirrels, bats can transmit rabies. Raccoons, for example, also. Toxoplasmosis is a parasite that occurs, but it can be transmitted through cat feces and can be a serious condition. Cat scratch disease is a bacterial condition which is transmitted when a cat pet may scratch you accidentally or accidentally bite you, and then their saliva or other, they might be interacting with you, and they can transmit this bacteria which causes this infection. Toxocariasis is also a parasite. This refers to some roundworms that populate the gastrointestinal system of both dogs and cats. And of course, if you are a pet owner, then you'll likely be early in the days of getting your dog or cat. You will treat them, with some medications to get rid of these things. Monkeypox is a virus very similar to symptoms and problems like smallpox, which is a very nasty condition and potentially fatal. This is a virus that's typically transmitted through rodents and primates, monkeys and chimps and so on. This is very common in Africa, not so much in our country here right now, but again, this illustrates that our interactions with animals, and particularly with our domesticated animals, dogs and cats, can have negative health consequences. Well, this is a time, normally when I talk about this slide, we point out emerging RNA viruses, and then we tell students, at some point a pandemic is going to come. It's different this year because SARS coronavirus 2, or COVID-19, is very much with us and here, and it's an example of how these emerging RNA viruses, so this is now 11, not 10, but all of these viruses listed are RNA-based viruses which have had a potential big impact on human health. Not all of these are prevalent in the United States, of course. AIDS, HIV, influenza A, COVID now. West Nile virus is very prevalent in Oklahoma, and this is transmitted by mosquitoes, and that's why it's always prudent to take proper mosquito protection when you go outside. And West Nile virus is a big impact not only on human health, leading to neurologic complications, and can give us severe inflammation of the linings of the brain known as encephalopathy, inflammation of the brain. It also affects our horse population and has a big effect on that industry economically. Zika is also transmitted by a breed of mosquito, a particularly difficult breed of mosquito to eradicate. SARS and Middle Eastern Respiratory Syndrome are viruses in the same family as SARS coronavirus 2, or COVID-19. The Middle Eastern Respiratory System or Syndrome, MERS, hasn't really been seen in this country, but in the Middle East, and it has a higher case fatality than we're seeing with COVID. It has a case fatality of about 30 to 40%. SARS, the case fatality was about approximately 10%, and we're seeing about 5% nationally now for COVID-19. So I just want to go through a little bit of COVID-19 in this context, just showing you here the timeline, a couple of things. So February 24 to 26 this year, we had only 34 cases of COVID in the United States with no deaths. And look, by Monday or yesterday, really, this was yesterday when I updated this, we'd gone from just in that time, 2 months, up to 794,000 cases. This is over 800,000, I'm sure now. I didn't update this from the very recent data today. And Oklahoma went from its first case on March 7th, 8th to just about 6 weeks later, having 2,800 cases and 164 deaths with a case fatality of 5.8%. So this speaks to the serious nature and high transmissibility and contagiousness of this virus. This shows some of the history of policies that our governor and mayors. Here I've put in what Mayor Clark was doing in Norman, because for many of you that's where you are or were. But the other mayors also of Oklahoma City, of Tulsa, had similar actions throughout their response to COVID. So as of yesterday late, Cleveland County had about 345 cases with 23 deaths, but 116 of those were in a long-term care facility. And you see many of the deaths were in the nursing home or long-term care facility. And that continues to be a vulnerable population. Some of you may have listened in when we went through this before. This describes the epidemiologic pattern of COVID-19. Here, the colored little area describes the time course. Here's time on the horizontal axis, the time course during which a person is infectious. This is a schematic. We don't necessarily know for sure this duration of time that a person is infectious. That's for sure not known. The point here is it could be that people are infectious for after they've, even after they have cleared their symptoms. And we need to figure out exactly how long people with COVID-19 shed the virus and potentially remain infectious. This vertical line marks the timing of infection. The incubation period refers to the time from infection until a person will show symptoms, and that ranges from 2 to 14 days. But the median for that incubation period is 5 days, meaning half of the people will develop symptoms within 5 days, half are later. But 11 days is the 97th percentile. That means 97% of people will develop their COVID symptoms within 11 days. But here is the a serious piece of information, the serial period, which is the time from infecting one individual to infecting the next individual. And that's been calculated from the epidemiologic studies and surveillance. And that is only 4 days with a range of 3 to 5. So you see that the time when one individual will on average go and infect another one is shorter than the time in which half or more people develop symptoms. And that is indeed one of the crucial elements as to why we have a hard time controlling this infection. That's called, and those people who do that are called pre-symptomatic. We also know, though, that some people become infected and never do develop symptoms. They still likely have a serial period and an infectiousness period, but they don't become symptomatic. And those people also can transmit infection, and that is a serious challenge to controlling the spread of the virus. Now, we can think of COVID as, if we think of it as a pyramid or an iceberg, then we just, it follows a pyramid pattern where Most of the cases, approximately 80% to 81%, this is based on older data from February and 44,000 cases of COVID in China. 80% to 81% approximately are mild cases with who don't have pneumonia or a mild case of pneumonia. They have other symptoms, cough and fever and fatigue and so forth, but no evidence of pneumonia either on the chest X-ray or CT scan. Severe cases include patients who have shortness of breath, who have a high rate of breathing. So the normal respiratory rate, all of us, if we're breathing normally, take in about 16 breaths a minute. These people will be doing 30 or more breaths per minute. So if you think of your dog breathing fast like that, panting or whatever, that's what you can often see these patients doing. The blood oxygen saturation, that means the percent of saturation of your blood with oxygen, which is the purpose of the blood, is of course to move oxygen around in our body. That drops down under 93%. And they have lung infiltrates, or areas of the lung that are infiltrated with infectious material and fluid in more than half of the visible area of the lung when we look at a CT scan or a chest X-ray. Those are severe cases. They need to go to hospital and probably intensive care. And shortness of breath is a very important symptom that should trigger, medical evaluation all the time. And then about 5% of COVID cases are critical. They will have serious respiratory insufficiency or failure. They will have so-called septic shock and or multi-organ dysfunction. But this is sort of like the tip of the iceberg. But if we bring it down to asymptomatic, we have way down here even many more people who are not identified as a case because they didn't have symptoms and we didn't test widely. We didn't just go out randomly testing the population. Here it says 2.3% died in this series, but the data for the US now shows a higher death rate than that. And as I showed you for Oklahoma, if we go back, here we're looking at a 5.8% rate, influenced to some extent by the cases which occurred in the nursing homes, but still quite a bit higher than our early experience here in China. So the Diamond Princess was a cruise ship in Asia, which was, of course, parked because they found out that people had COVID infection. In February 20th, there were 634 infections of COVID among the 3,700 passengers on the Diamond Princess. This was known because they tested everybody. And 328 of these people did not have any symptoms, indicating asymptomatic penetration of about 51% in the population. And these people who were asymptomatic were clearly also helping to spread it. Okay, last week, at the end of the week, the White House, President Trump implemented or released some guidelines for coming out of the shelter at home and opening up America. Governor Stitt did some press conference mostly discussing this stuff earlier this afternoon. And they're developing their own guidelines that essentially model what the president has put here. And so there are a couple of things to this that I want to just orient you to, and you'll be living this and seeing this happen. So the first thing is that state by state or regions, counties or cities, these states or regions will need to satisfy certain criteria before they then begin a phased reopening of the society in terms of, restaurants reopening, gyms and other places. So getting back to our normal societal function. That's not going to happen quickly by a flip switch. It'll happen as a phased approach. And the White House document describes 3 phases for doing that. But before we even begin, we have to satisfy these gating criteria. Hospitals have to be able to treat all patients without a crisis care, and they need a robust testing program in place, particularly to test at-risk healthcare workers, so that we can detect healthcare workers, for example, emergency room doctors or nurses who may get exposed. We want to test them and bring them out of the care pathway for a period of time so they don't pass their infection on to other patients. So there's some criteria there that we need to be able to treat all patients with appropriate ICU care and have robust testing available. Regarding cases, we need to see a downward trajectory of the documented cases over the last 14 days, meaning that we're getting fewer and fewer new cases every day, or a downward trajectory in positive tests as a percentage of the total tests. And that's essentially showing us the same thing. So here is the curve of the case pattern in Oklahoma. On the vertical axis shows the number of new cases, and the horizontal shows the date. So this will be the number of new cases every day that we plotted starting in March. You can see here March 11. There were not that many new cases, as you see here, for a while, until about the 23rd, 25th of March. Then this curve began to really take up in terms of an exponential increase. This is the 3-day running average because it smooths out variation caused by backlogs of testing at the labs. If a lab receives a batch of cases today, but then doesn't test it for 3 days, and then gets a large number reported on one day, it can skew this kind of information. So we like to look at a 3-day running average. Well, you can see in Oklahoma, the curve just went straight up. And here we were up to 147, 141, 130, that level of number of new cases every day at the beginning of April. And then if you plot that moving average, you see a bit of a pattern. It's volatile, it goes up and down a little bit, but you can see a definite negative trend or negative trajectory down. And that's what's prompting the governor to think about the reopening now for some areas this Friday, and then for others at the end of April or early May. Well, I just want to touch base on the guidelines for individuals and employers and not go through the phases. We can post the document up to, if we haven't already, to Canvas. You can read it, but there'll be a phased in if the city or county meets the criteria for gating with a downward trajectory of new cases and positive test results. Then we can begin a phased in return to the prior, let us say, usual situation. We want all individuals to practice these hygienic things at all times, not just for COVID. Wash your hands, soap and water, use hand sanitizer, avoid touching face. If you have to sneeze or cough, do it into a tissue or the side of your elbow. If you do it into a tissue, throw that out into the garbage and wash your hands. Disinfect items regularly, surfaces and items. And this is the most important, and one we really have to get across to everybody. We need to use face coverings when in public. That means a mask, some kind of a mask. Now here the goal is not to prevent each of us from acquiring infection by our mask, but to prevent us from spreading it to others. We may be asymptomatic carriers who don't know we have this virus, and when we go and talk with people or have lunch at a restaurant or something, we may be spreading this virus to our closest companions. Mass transit, of course, is a particularly challenging area. So on the subway and in New York, for example, or Washington, D.C., or wherever they have a subway or metro, that's, buses, other travel where people congregate and are packed into a small area with close contact, that can be a potentially dangerous area for contracting COVID. Needless to say, people who have symptoms or who feel sick with fever, cough, sore throat, shortness of breath, etc., they should not go to work or school. They should contact their medical provider and get instructions about what to do. Probably they will be isolating until test results become available. Let's just see. Okay. Now, employers are also required and asked to take their fair share, and I think this is a good thing. That is that they should have some policies for dealing with people when they return to work. Social distancing will remain, so we will still be, for a while, keeping people at least 6 feet apart where they can. Testing, isolation, and contact tracing is the most important piece here that I'll come back to in a minute. There needs to be regular disinfection and cleaning. We need to minimize business travel and keep that down to an absolute minimum, or even keep that closed for a little while still. And we can't stress enough how important it is that if a person has had COVID-19, they are cleared by their physician or a physician before coming back. That's crucial. So these are guides for the employers. Then the document then goes on to talk about phases of this transition, and there are going to be 3 phases by which we phase back into a more normal population. You can Google this through the White House, or we'll put it up on Canvas if we've not already, so you can read this for yourself. But I really chose here to emphasize what all employers and what all of us as individuals can do to reduce the transmission of COVID. So those are the comments I wanted to make today. I thought it was particularly important that you talk about the One Health, or this concept, in the context of health reform, because V'lana has loaded the White House document to Canvas. COVID illustrates again what can happen when these viruses jump from animal species, such as a bat. They can jump from the bat to another animal. The bat, or for example, the snake, may be bitten or eaten by another species or another animal or human. And this is how these viruses can jump from being traditionally contained within animals, zoonotic infections, but to where they come and infect us as people. So I wanted to cover the One Health concept. Think about that in the context of COVID. Think about global health and how global health influences global travel, particularly, and other patterns influence the health of people all over the world, and how easy it is to transmit and bring these conditions to others around the world. So that's what I wanted to cover with you here. I'd be happy to answer any questions. Use the chat, please. You can do, I think, one of 2 things. You can put your question right in through the Zoom chat, or you can raise your hand, or just type raise my hand or so on if you want to be unmuted and speak your question or have some comments with me. Any questions? Thank you, Jordan. Yes, this is being discussed. I can tell you I've had conversations with OU President Harris and with the provosts and with the executive leadership, and there is a lot of work happening right now. And I think that if we can transition out of the sheltering and we don't see large resurgences or outbreaks, that there will be, the plan would be to have some resumption of classes, school resuming in person, with some modifications, of course, to mitigate transmission. We don't want to congregate in large groups. There'll probably be caps on class size so that we can spread you out. So if you think about our class, this class, how we've sat in class, that's a little bit too close. What we might have to do is have more sections and then have people sitting farther apart from each other, 6 feet or more. But there is a large effort, work going on to define a process by which we can hopefully safely come back to, to campus presence and having students on campus and classes in person in a modified way. It's going to be a little bit different. Obviously, there are some classes, some of you may have been in those, which are like 200 people. Even our class for this course at more than 80 people is too large, so we'll need to split that up or into 2 or 3 groups or so on. But yes, we're working. It's our hope that we can resume significant in-person activity in the fall semester. That will, of course, depend on the conditions at the time, but we hope that we can, as we transition out of shelter at home, that we can keep the virus down to a manageable level through identification of infected people, testing them and isolating them, so that we don't see the broad community spread that we rapidly saw. I think that's very, it's very impressive to keep in mind how quickly, I just want to show you again that slide, COVID in Oklahoma. This timeline, I need to share my screen, I guess. Let me get that screen for you. So when you look again at this slide, in just not quite 2 months, or 2 months, we went from 35 cases in the US to almost 800,000. That tells you that this virus is very, very highly transmissible and contagious. And so we have to have good strategies in place to not let that happen and not let that, surge ahead. Okay, Christina has a question. How is this impacting admissions to programs? You should just continue to go about your applications. We're reviewing applications. We're doing all of those things through, distance working relationships and electronic communication. So go ahead and do your applications as you would. Yes, Amanda has a good question, which is, if we do reopen business in Oklahoma by April 30th, do we think we'll see a resurgence in cases? That's going to depend on the area, right? And I think, the crowded areas are Oklahoma City, Tulsa, Norman, maybe Lawton, other cities with a significant population. And we hope not. We hope that we will be able to control and prevent a resurgence through the guidance and the guidelines that are contained in the White House document. And among those, the most important is that we should all, every one of us, should wear a mask or some type of face covering when we go in public. And the reason is, again, not primarily to protect us from getting infected, but to prevent us from transmitting our respiratory droplets and other things to other people, because each of us could be an asymptomatic carrier of the virus. So the CDC recommendation that everyone wear a mask doesn't have to be one of the complicated N95. It has to just be a surgical mask or a other face covering that can prevent our transmission. And I think that will go a long way to helping us avoid a resurgence and keep the cases down. There'll always be a number of cases. I don't think we'll get it down to zero anytime quickly, but we'll keep the number of daily new cases down to a low value. And your cooperation in wearing masks and in following all the guidelines about social distancing, everybody's cooperation will be crucial to avoiding those resurgences. Very good question, Amanda. Thank you. All the questions are good. But that's the fear. We need to avoid the resurgence and keep the daily number of cases down. Other questions? Christina, very interesting to hear what Dallas has done. That's interesting, yes. So I think what will happen in Oklahoma will be that the mayors may or may not go along exactly with what the governor wants to do. And they have independence, and the White House document gives them some independence too. So I think for sure, neither Norman, Oklahoma City, or Tulsa will open this Friday. The governor's order ends on April 30th. And I think it's possible that one or more of those cities could well decide to extend the shelter at home for a period of time. May 15th seems quite logical to me because we only really implemented this in a big way on end of March, and I would like to see a little more than a month. It takes people a time to get engaged with it. Also, I noticed when the CDC came out with the recommendation that everyone should wear masks, in the early day or two, I didn't notice a lot of people complying with that when I had to go to the grocery store or the drugstore. But more recently, I've seen it looks like quite a higher level of compliance with this. I've been pleased to see that. And I think there could be some value in extending to May 15th, like you indicate, to give us more time to get ready. We have to be ready to contact trace and isolate any people who pop up with infections so we don't get a resurgence. But I think there's not a small possibility, I think a reasonable chance that one of those mayors of Oklahoma City, Tulsa, or Norman, at least one of them might adjust their timing. Of course, if Oklahoma City does one date and Norman the other, it's kind of, people can travel back and forth very easily between these adjacent cities and counties. So I know that those mayors are going to talk with each other and try and work together, but it depends on the data. We're trying to have a data-driven approach as to when the removal of the shelter at home is. Certainly May 15th would give more time to have a lot of things ready and in place. But the small business that have been shut down, the restaurants, the various others are very anxious to, of course, get back to work. For some people, they've had no income, and that's for weeks now. Many others have been laid off their job and so forth, and so there is important issues to address. One of the important things is reestablishing normal healthcare routines at the hospitals, elective surgeries, for example, and other things where people have been waiting because that was all shut down for a while just to protect patients from being exposed to COVID when they come in, say, for their knee replacement or some other operation. Other questions? So I think the hospitals will resume pretty quickly after the end of this week. And that's important because one of the side effects, if you want to call it that, of the COVID, it's not only the people who get sick from COVID, but just because there's a pandemic doesn't mean that heart attacks and stroke patients and patients with GI bleeding and all kind of emergencies, that those suddenly stop and go on hold. But if we can't get good care for those people, or people who are suffering through conditions that could be fixed surgically, and it's not an emergency that we operate on them, but we want to do it quickly to alleviate their pain and fix their condition. Those people have been, postponed and waiting. We want to reopen that parallel care, for those people, because there's big health impacts of those things also. Other questions? Okay, well, I want to say again, so please watch for a short lecture that I'll post regarding other aspects of the chapter 14, Systems Thinking. The slides will be posted up to Canvas. And then you will have time. Your last quiz will be next Wednesday, the 29th. Remember that we will automatically drop your worst quiz grade, so one of your quizzes will be dropped. I know many of you submitted very good responses for extra credit, and I want to congratulate you and thank you all for that. And those marks are posted as well. And you all have been very thoughtful and supportive in the challenge we faced with this COVID. We've tried to do the best we can to keep this education going for you in a good way. I would have liked to have been able to have a little more live engagement with you, but in the early days that was not feasible because of all the many other responsibilities. But I appreciate everyone joining in today to have some discussion. And I'm also hopeful. I want to get back to a little more normalness with the university campus and so forth. But I appreciate all of you and the patience you've had. And please check Canvas regularly. There'll be announcements there. The final quiz, again, you'll do that, and then there is no final exam here. You had your midterm papers, which most did well on. So you'll be able to see your final grade pretty quickly after the quiz next Wednesday. Is there any things you want to announce here, Valana, to the group through the chat? Good on your end. Okay. Thank you. Email if you have questions. Watch Canvas for the clear instructions. I've enjoyed having you as a class. I was a bit sad when the COVID hit and I was just getting to know some of your names and other things. And so I hope that I will see you, through some of the other courses in the public health major. And I want to wish you the best for a very good very good summer. Good luck for the rest of this semester. Um, Public health is a great field. This is a great time to educate the public about public health. And please educate and do your part to people about, you know, the importance of complying with the masks. I think that, you know, it looks a little, maybe have fun with it too. Engage them to do some fashion that way or something, or you know, do some things that can be fun. But if we do that, I think we'll go a long way to keeping the infection down, and allow us to reopen. So wish you all the best. I wish you good luck on your final quiz. And you can look for your marks pretty quickly once that's finished. And don't hesitate, if you have specific questions, email through Canvas and we'll answer them. Thank you very much. Have a great day. And I don't know, Christina, what the thunderstorm situation is like right now in Dallas. In Oklahoma here, we're getting some thunderstorms coming. So everyone also watch the warnings, please, and stay safe from thunderstorms or potential tornadoes. Thank you, and have a really good afternoon and a good week to conclude out the course.